Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Break.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Well, hey everyone. Yeah, it's not breakfast time, and you never know where I'm going to show up. Actually, this is my workspace at the new office. I have this huge window behind me, which I absolutely love because the sun shines in and keeps me warm. I've got my little cavalier over my shoulder, and I don't know if I should show you what's over my other shoulder, but my sister gave me that for Christmas. I don't know if she's trying to tell me something. Whatever. But anyway, so 2 years ago, those of you who follow me, you know that over 2 years ago at Super Zoo, I passed out and fell backwards and fractured my skull. Needless to say, that did a good job of jarring my spine because I didn't get my hands out to catch myself. My head caught me, and that's not the way to land. And then almost exactly a year later, we had a really bad rainstorm. And so it was right about getting dark, and Hugh and I decided we should run out to the barn and close up the animals because it was one of those just torrential thunderstorms. So we ran out there, and right when it started, and after being out in the barn for 20 minutes with everything pounding around us, we said, okay, seems like it's lightening up a little bit. Let's make a run for the house. We ran for the house, and as we hit our nice garage floor, which had this epoxy coating on it that was soaking wet, I hit the floor, my feet went out from under me, and I went down hard, thankfully not on my head, but landed right on my sacrum. So in people, we have 5 lumbar vertebrae. Our dogs have 7, and cats have 7. So my L4, L5, and sacrum took a really bad jarring hit. So I laid there for a minute and then, got up and limped off. But that was 14 months ago. So 2 bad falls, 2 years in a row. And I've had sciatic pain down my left leg for over a year. And my mother had fallen somewhere in the middle of all that as well. And she had sciatic pain, so she went to the chiropractor. It didn't help after months of treatment. So then she went to physical therapy. They gave her a bunch of exercises, and she's doing great with it. So, but she's very good. She does her exercises every morning. Then there's me. I'm like, okay, drink my cup of coffee, and then hit the ground running, and I don't take time to do what I need to do. So over the months, I've gotten worse and worse and worse and worse. The sciatic pain is to the point where it's just killing me. And then trying to carry baby Sarah, who's now almost 25 pounds, on my left hip all the time is just really not helping my back. And now I've got pain in my ankles and my feet. And my biomechanics are completely wrong. One shoulder is higher than the other. For those of you who watch me, you see a lot of times I'm trying to even up my shoulders because I can see what it looks like in the picture. So I'm trying to, my hips are not even, my shoulders are not even. And I know that adjustments need to happen. But, during COVID, when we lived in New Jersey, everything was shut down. Chiropractors weren't even allowed to be doing their thing. Dentists weren't allowed to be open. I mean, it was just crazy. So it's gotten to the point where I can barely walk. My feet hurt so much because my biomechanics are completely out of whack. So I finally bit the bullet, found a chiropractor, sent an email on Sunday. They called me early yesterday morning, got me in yesterday afternoon. I feel like $1,000,000. I feel better than I have felt in a year and a half. My spine can finally move. When he, did the on the neck, which I absolutely hate. The sound and the tearing of all those adhesions from everything just being so stuck. Like I wasn't able to turn my head, and now I can. He actually said to me, "Well, you have great flexibility." I'm like, "Well, I do now after you fix things." But, it made me realize when I first learned how to do chiropractic adjustments, we had a horse farm, and Gwen's dad and I used to do a lot of chiropractic work on horses. We did a ton of farm calls. We had horses come to the farm. And we also at the time were doing a lot of showing horses. And when we would go to horse shows, I would watch horses in the arena, and it was like, oh, that one's got a right hip up, that one's got a left hip up, that one's out in the SI, that one's got a lumbar spine problem, that one's, the mechanics of the legs, they're not firing correctly. Wow, that horse has horrible hock problems based on his spinal problems. And it was always right in front of me. Like I always was evaluating animals, watching them move. And when I was in clinical practice and dogs would come in with arthritis or back pain, a lot of times one of the things we would do is we'd take them to the parking lot, or we would put them out in our hallway, and I would stand at one end and I would watch them trot away and watch them trot back and watch the biomechanics. Frankly, for the past few months, I couldn't run if I had to because of the pain in my knees, my ankles, my feet, because my biomechanics were all wrong. The nerves in my back were not able to fire correctly to the joints, which means when you watch an animal who is well adjusted and has no spinal pain and no joint pain, particularly an animal that's well built. So we also have to consider the conformation of the animal. And most of us don't consider that when we're buying dogs. And frankly, a lot of our dogs and even cats have been bred to have poor biomechanics because I remember years ago, and I think it's changed, but they used to want the shepherd breeds to be very low in the back end. So you'd see these show dogs and they literally were almost crouched all the time. Their hocks were so low. Bad biomechanics. So, one of the things when you watch, for instance, a horse, but the same thing with dogs, it's hard to do with cats because, go tell your cat to run down the hallway when you want him to. Probably won't. Maybe if they're willing to fetch a toy. But when you watch an animal that has very fluid movement, it's like watching, they float on air and their joints are just floating. And with horses, when you watch them trot away from you, if their spine is in great shape, that tail head will be moving back and forth like this. And it's very fluid and soft and supple. And then you watch an animal where the spine, literally they have like a broomstick stuck up their spine. And instead of seeing that tail head doing this, it'll be stuck. It may be stuck to one side. It may be just stuck straight in the middle. It may be stuck a little up. It might be stuck a little bit down. And then when you watch the legs, they're firing like pistons instead of floating nice and normally. So that's our goal. Whether you're using chiropractic, acupuncture, cold laser, acupressure, there's massage, because I've given up my massage for the past year as well. But when you use all of those modalities, you can take an animal whose joints are firing like pistons, and believe me, when they're firing like pistons, they are eroding the joint cartilage, they are destroying the joint fluid, they're developing arthritis, it's causing the joints to fall apart. So it's so important. Everything comes from the nervous system. Everything comes from the brain to the spinal cord to the nerves that are going to the muscles and to the joints. And if we've got a blockage somewhere where the energy just stopped moving, which for me was in my neck, but then also in my lower back, everything was just totally out of whack. The body will compensate. The body will figure out how to move, but it's going to move very differently. It also affects digestive function, heart function, because all those nerves that are coming from the spinal cord are innervating all the organs as well as all the joints. So I've seen animals where they had a stuck area in their spine. We see this a lot in kitty cats, and they will start to bite at that area. You'll see a spot in the coat where it's dry or it's greasy, where it just never gets to normal, and it can be a very small stuck spot. We do chiropractic or acupuncture on those animals, and poof, the spot goes away. Now we have the oils flowing through the coat and through the hairs. So I just, now that I finally went and got myself put back together, and I'll go again on Thursday, I can't emphasize enough how important that spinal cord function is, and how important it is to have fluidity and just motion in the joint, flexibility, just motion in the joints. So chiropractic problems come because the two joints where the vertebrae come together, where there's a lot of joints there, but where the two vertebrae come together, and it just gets stuck and it's not moving anymore. And so from that point backwards, things are not radiating correctly, and it just gets stuck, and the body will try to compensate for that. So if you are lucky enough to have a veterinarian who is good at diagnosing those kind of problems and has some way to help treat them, really, really, really helpful. And there are some human chiropractors who are trained to work on animals as well. So if you don't have a veterinary chiropractor in your area, you might see if there are some who have any experience working on animals. There are differences. Our bowling ball sits on top. The animals, their bowling ball sits, kind of at the front of the spine. So we have compressive forces, and theirs is sort of a hanging force off of when the bowling ball's off at one end. So a little bit different. But a spine is a spine, and a spine needs to have fluid movement in it. Okay, everybody have a great day. Supporters, I'll see you in just a few hours for an Ask Me Anything at 6:30 tonight. If you didn't get the notice, there's your notice. Okay, everybody have a great afternoon. I don't know, for some of you on the other side of the world, it might be morning. I don't know. And we have snoozing dogs everywhere. Gwen's showing them on Instagram. I kind of can't get, maybe I can. Snoozing dogs. Stewie and the puppy. There's Gabby with Gwen. The other way. There's Gabby. George is around here somewhere. I think Panda went home. Did Panda go home? Oh, Panda's in a different bed. She's in the beanbag. I don't know. Dogs everywhere. All right. Have a great day.